So the testing that we need for our initial review of your case are pulmonary function tests. If you have had emphysema for a while, then you know perfectly well what these are. We put you through a lot of different maneuvers to test different aspects of your lung function. An arterial blood gas, which is just a lab test where we take a syringe with a needle and put it into the artery in your wrist, withdraw a little bit of blood, and then that goes to a lab to analyze the oxygen and carbon dioxide content in your blood. Gives us a very good idea about how your lungs are functioning. The chest CT scan, as Dr. Wood already mentioned, and then an echocardiogram, which is an ultrasound study of your heart, just to give us sort of a starter idea of how your heart is functioning, because the heart and lungs work very, very closely together. And when you do have a severe lung disease, it can often impact the function of the heart as well. All right, next slide. So after the committee reviews the case, any information, any recommendations that the doctors have made is put in a letter and it's sent to your referring provider. But before that letter goes out, I contact the patient directly and we go over it step by step, whatever that plan might be. If you are a potential candidate for Zephyr valves or lung volume reduction surgery, that generally involves being scheduled for some additional tests and a consultation at the University of Washington in our surgery clinic, where you would meet with one of the surgeons and myself, as well as our other staff, either our physician's assistants or our residents. Some of the things to know, important eligibility requirements for any of the procedures that we do here at the University of Washington. Keep in mind, you must be non-smoking. That has to be a habit that is put behind you. So patients that are currently smoking need to stop, or if they have only recently stopped, then we do screening. We require that you be non-smoking and not using any nicotine, tobacco, or marijuana products for at least 4 months before the evaluation. For patients who are maintained on oral steroids like prednisone, you have to be on a stable dose of 20 milligrams or less. Prednisone can interfere with healing after surgery and these types of procedures, so we want to keep it as low dose as possible. And then finally, as Dr. Wood also talked a little bit about the pulmonary rehabilitation, you have to participate in a pulmonary rehab program. This is a program of structured and medically monitored exercise and education for patients with severe lung disease. Our goal with pulmonary rehab, first of all, it has been widely studied for years. It is known to be one of the best known medical therapies for COPD, but we also want to try to maximize your fitness and what you're able to do, primarily walking, before you have these procedures, which is going to make a difference in your ability to recover afterwards.